okay.
That's fine, that's fine. All right, so even before going over these needles, so most importantly, these are going to be her vials. They do need to be kept in the refrigerator, most importantly. Granted, we're having a conversation here now for about 20 to 30 minutes and they're going to be left on the counter, and that's fine. No big deal.
Okay.
So if for some reason you're going to draw these up, the phone rings, you go and do something, you walk away and you're like, oh shoot, the allergens, it's all good. If for some reason they're left out overnight or in direct sunlight or in freezing cold temperatures, then we would want to consider replacing them, just due to the fact that these are human grade allergens. And in those temperatures, what happens is they just kind of lose their stability. So in return, we're just going to lose our efficacy. So if anything funky happens, you're questioning anything, you just call us, let us know, no big deal. Okay?
Okay.
Okay. So yes, like I was saying before, the needles and the syringes are pretty small, which is really, really nice. These injections are what we consider subcutaneously. So they're not in their muscle. So like when you and I get an injection and we're like sore the next day, we're painful the next day, it's because it's in our muscle. So this is a easy subcutaneous injection, and we'll show you how to do them today.
Okay.
You're also going to be going home with 25 needles that are these exact ones. Every time we give an injection, we want to use a new needle. And then when you're done, we want to just keep them in a safe place. And then you can bring them back to us and we'll dispose of them for you.
Okay.
Okay. So, allergens. Like I was saying, these are human grade. But with that, I still like to go over some of the safety things and what we want you to watch for and look for at home. Granted, we are injecting her with things that she's allergic to. So I like to just have people keep that in the back of their mind. So very rarely, sometimes when we give an injection, I think I maybe have like 1 or 2 phone calls. After an injection is given, I've had people call back and say that they've noticed like a little bump underneath the skin where the injection was given. So we ask that you call us, let us know if you notice that. Sometimes we'll have you like administer some Benadryl at home, but most of the time we just have you watch it, monitor it. Usually goes down within 24 hours, and we'll just have you kind of keep an eye on that as weeks go by and as we're continuing to administer them. But again, very, very rarely have I seen that happen.
Okay.
What we want you to look for at home, kind of in this startup phase here over the next 9 weeks, is after an injection is given, we want you to look and monitor for any increase in itch 24 hours after an injection is given. Okay? And it's usually a heightened level of itch. Not like that we're concerned, or I would want you to like get her to a vet right away, but I would want you to call us and let us know. So whether that be she's kind of scratching extra where we gave it, like maybe rolling around on her back, it would just be a different heightened level of itching or licking or chewing.
Okay.
And if that's the case, nothing to panic about, but we want you to let us know. So with that being said, I usually ask people to pick a day that works best or better for them to kind of give this injection. And that's kind of only in this startup phase, just to kind of keep an eye on them. So I don't want people giving it at like 7 in the morning, going to work all day, or leaving them for like 10 hours or so. So most people do pick weekends, but it's realistically whatever works best or better for your schedule.
So you can observe.
Exactly. I mean, just observing. I don't want people at home like ruining their whole day and like staring at the dog. But you know, just so we know maybe we're going to be in and out, or someone's going to be kind of available just where they're not left all day. Also too, picking a day, if that day needs to be changed for some reason, this is a very, very kind of forgiving schedule, I like to tell people.
Okay.
So we're going to monitor for some itching afterwards, and that's really just what we want you to kind of look for at home. Of course, an allergic reaction would be different. An allergic reaction would happen usually an hour or so, probably even sooner, after an injection is given, and that would be like if you and I were to have an allergic reaction, we would you maybe see hives, we would have an intense level of itch. Sometimes there are kind of like muzzles can swell up, and then we would want to get her somewhere right away, contact us, but we would want to get her somewhere right away, or she would maybe need
so for emergency care.
yeah, or even her primary vet, realistically, but just somewhere kind of right away. Most of the time they would need like IM Benadryl, sometimes they need like IV steroids to just kind of shut down that reaction.
I see.
And then a true anaphylactic reaction, my understanding has never been recorded in veterinary literature with dogs and cats with immunotherapy, but that would happen pretty instantly and we would want to get her somewhere right away. Okay? So, her vials. So you're gonna see 2 vials here. And you're gonna see 2 vials because she tested positive to certain molds and to certain pollens. And over time, if we were to mix these 2 together, the molds would eat the pollens. So they have to be kept separately. She's still going to be receiving 1 injection, but every time we give an injection, we're gonna be drawing some from what's labeled vial A and some from what's labeled vial B. They can go into the same syringe. That's not a problem. It's just over time, months and months going by, the molds will kind of eat those pollens up. So that's why
mixed,
if they're mixed. So that's why they're separately. So, I'm assuming that we're not going to be giving her her first injection today.
We are.
Okay, cool. We can do that. I personally like to give the first injection because it's the smallest quantity to draw up, and I personally think that it's the hardest one. So, today is going to be the start of week 1. So, using 1 syringe, we're going to draw up 0.05 from vial A, and then 0.05 from vial B into the same syringe to equal a total of 0.1, and we're going to give subcutaneously. So, if I go and do that, I'm going to seal bottle 1 here. This is vial A. You always want to draw from vial A first, and as the weeks go by, it's always going to tell you to draw from A first, as this is where the pollens live. So I can stick this in here as many times. You don't ever need to like clean this surface for any reason with like an alcohol pad. So with vial A, realistically, we have the capability of drawing up more than we need and pushing it back into this vial, right? So we can draw some up, we can push back in. That's kind of no big deal. Sometimes there'll be some ear bubbles here. You can flick them out. There's not really any in there at the moment. So 0.05, like I said, is the hardest to give because it's the smallest quantity, and it's gonna be this little line right here. So I now have what I need from here, and I'm gonna go ahead and draw up the rest from vial B. Now, when you puncture this, the liquid doesn't like automatically go back in there, but I always tell people to kind of keep their fingers on the plunger and just draw up slowly. I know, honey. Because we have to think we don't have the capability of pushing back, drawing up more from vial B and pushing it back in. Okay, so for first one, little ear bubble there, don't worry about that. Sometimes you'll never get those air bubbles out, but there's sometimes a tiny little one at the top. So that's the hardest one to give, like I said, because the volume is so small. So when, hi honey, she can have any treats, right? Okay. Do you want a treat? I usually tell people to make this a pretty positive, hi. Those are boring, maybe? Yep, thought so. Yeah, let's try to get you something a little bit better. That's all you got? She's like, that's all you got? That's boring, lady. Hi, honey. What's this? Oh, good girl.
Is this better?
Is this better? Yeah, much better. Thank you. So always try to make it something positive. That's the boring one.
Well,
oh, good.
Let's try it out.
So, come here, baby. So realistically, this is, come here, honey, look at all these chains. Being a subcutaneous injection, it can be given anywhere, but most of the time we kind of do it right in, hi, look at Sure. Right in between their kind of shoulder blades. So you'll feel her shoulder blades are here. I'm a righty, so what I'm gonna do is lift up with my left hand, and you can really lift up her skin. You're not gonna hurt her in any way. And you're gonna administer kind of right in this little tent that you kind of create. So if you wanna feel right here, that's kind of where I would give it.
Right in there.
Yes. So, gonna uncap my needle. Good girl. I'm gonna feel. I'm gonna poke, and I'm gonna give. All done. That's it. Good girl.
Please have more treats.
Good job. So they usually tolerate it pretty well. They usually don't even feel anything.
It's
Super quick. The needles themselves are short, so you usually, with her, you're lucky because she's short here, so you're gonna like see that you gave it.
Yeah.
But you're gonna actually feel that you kind of penetrated the skin, and when you feel that, you're just gonna push.
Okay.
Okay?
Okay.
If for some reason she moves, right? You're giving this and you don't have help one day and she moves, and maybe some afterwards you feel and like her fur feels wet and you're like, oh, I don't know if she got all of that or not, or maybe she did, maybe she didn't. We never want to re-administer.
Okay.
Okay, we're just gonna move on, call it what it is, and wait till the next week. Of course, if she moves and you still see the liquid in your syringe here, then you of course can go ahead and give the rest of it.
Yeah.
But if we're questioning anything and we're not quite sure if she got all of it, just call us, let us know if you have questions, but we usually just say don't even worry about it. We never want to re-give another one.
Okay.
Okay? So, that's the hardest one to give because it's the smallest one. Next week, as the weeks go by, it does get a little bit easier here for you.
Okay.
So, next week we're gonna jar up 0.1. So, we're gonna go kind of right to this bold line right here.
Okay.
With the plunger too, you're always gonna look at the top, not the bottom. So we're gonna jar up 0.1 from vial A, 0.1 from vial B to equal 0.2.
Okay.
As the weeks go by, it just keeps moving up. So week 3, we're gonna jar up 0.2 from vial A, 0.2 from vial B to equal 0.4. Week 4, it's 0.3 and 0.3. And then by week 5, we're already at that bi-weekly. So week 5, we skip this week and we do not give an injection.
Okay.
Week 6, we jar up 0.4 from vial A, 0.4 from vial B to equal 0.8. Week 7, we skip. And then by week 8, we are at what we consider her full volume dose. So we're never going to exceed past the 1 ml. So her full volume dose is always going to be 0.5 from vial A, 0.5 to equal the 1 ml. So it's going to be the whole syringe.
Oh, okay.
Week 9, we skip. And then week 10 and beyond, we continue to give an injection of 1 ml every 2 weeks.
Okay.
And then by week 10 is usually when we like to see them back. Okay, so we'll usually schedule something by week 10. That's just a little over the 2 months. In an ideal world, we'll start to see benefit. We do see dogs seeing benefit as early as 2.5, 3 months into this.
Well, her situation is that she's been out of the allergy environment, so we've got all of her allergies under control, but she's going back in. So we're going to see whether this helps her not get re-triggered again.
I didn't look at her blood allergy testing. Sometimes they print me a copy. Is it mostly pollens? Is there dust mites, storage mites?
There's some dust mites and storage mites.
Okay,
Yeah.
okay.
So anyway,
So yeah,
it may be that she's just doing awesome.
Yeah.
And no change. Like right now, she's doing really
she's
well.
doing good, good. I mean,
Yeah.
yeah, I can see a little bit of staining in her paws. Do you lick your paws, honey?
She does.
Yeah, yeah. Okay. Well, yes, hopefully our goal is to, start immunotherapy, and as we get into warmer weathers or even colder weathers with those dust mites and storage mites, wintertime can be worse for some dogs when you close all the windows and you have that heat blaring. So our goal is over the next year, we give immunotherapy a year before kind of calling it quits and saying, okay, in this year, how many flare-ups have we seen, or how many times did she need additional treatments for anything? But our goal is to have this kind of replace everything and be able to control all of those symptoms, so we don't need to have her on any other medications long-term.
Okay.
Also, it is the safest, which is really nice. There's no need to monitor blood work. There's no long-term side effects that we need to worry about. When she's on immunotherapy, we can be on any medication. It doesn't contraindicate with anything, which is really nice. The only thing that we do ask of is that she does not have an allergy injection on the same day that a vaccine is due, which pretty easy to accommodate once you're on that every 2-week marker. That's kind of no big deal.
Okay.
Okay.
So we're gonna take a trip to my son's in Belfast. So it's a 2-hour trip. Is that gonna be a problem for these?
Right now, I'm gonna put them on an ice pack for you.
Awesome.
And then you can just plop them right in the fridge when you get there.
Okay.
And then she's not going to be due for another injection until next Thursday.
Right.
So it's today, the 9th. So the date given was Thursday, 1/9/20. Okay. So yeah, when you're going to your son, if your son's going to be the one administering these, if he has any questions after listening to this, watching this, it can be a little confusing. So just have him call us with any questions whatsoever. Okay. This is your schedule. Gonna send you home with this. This is your receipt. You paid over the phone. I'm going to go plop these, and this is all yours. That's mine. We do a couple of check-in calls along the way just to make sure injections are going okay. I'm also going to send a letter to her primary vet right now, letting her know that we have officially started immunotherapy. Okay. And that's about it.
And the ice pack you're talking about, is that something that we should also use when we go to Belfast?
It can't hurt to just transport them on an ice pack.
Okay.
I mean, granted, it's so cold outside, but that you're gonna have heat in the car. And in the summertime, if that comes around, it's gonna be hot. So yes, I'd put them on an ice pack, but they're safe on an ice pack. I mean,
they won't freeze up.
They're not going to freeze out. Sometimes in the summer, we ship allergens a lot to people who live further away and can't make the 4-hour drive just to pick these up. And they're fine. We usually just put them on an ice pack and they're fine overnight. Okay.